All right, welcome to the Explainer. Today, we are pushing deep into the red zone. We're going to demystify one of the toughest, but also one of the most revealing tests in all of sports, the VO2 max test. It's the ultimate measure of endurance, and we're going to break down exactly how it works, what it's measuring, and why on earth athletes would ever put themselves through it. I mean, just look at the focus in her eyes. That is a look of an athlete right before they push their body to its absolute physical limit. So you got to ask, why would anyone voluntarily do this? Well, the answer is actually pretty simple. It's all about the data. It's about finding out scientifically what the engine inside your body is truly capable of. So here's our roadmap for today. We're going to start with the why. Why would you even test your limits? Then we'll get into the nitty-gritty of what VO2 max actually is. After that, we'll gear up for the test itself, walk through the whole punishing process, and finally, we'll learn how to decode all that data. All right, so let's jump right in. Section 1. Why even test your limits? What are the benefits of putting yourself through a physiological assessment like this? The benefits here go way beyond just getting a cool number to brag about. This data, it's a seriously powerful tool. It can help you predict how you'll perform, it can shine a big spotlight on your weaknesses, and maybe, most importantly, it gives you a solid, concrete benchmark so you can measure your improvement and know for sure if all that hard training is actually paying off. Okay, let's get to the engine of this whole thing. What exactly is VO2 max? Time to understand your body's maximum oxygen uptake. So, what are we talking about here? Well, maximal aerobic power, or VO2 max, it's basically the maximum rate that you can consume oxygen when you're going all out. The best way to think about it is like the size of your body's engine. It's the absolute peak amount of oxygen your body can suck in and actually use during really intense exercise. It's pretty much the gold standard for figuring out how good you'll be at endurance sports. Now, here's a really key point. There are actually two ways to measure this. You've got absolute VO2, which is just the total amount of oxygen you're consuming, measured in liters per minute. But then, and this is the important one for comparison, you have relative VO2. This one takes your body weight into account. So it's milliliters of oxygen per kilogram of your body weight per minute. That's the number you hear elite athletes talking about, because it lets you compare a huge linebacker to a tiny marathon runner on a level playing field. And your VO2 max score? It's not just some random number. It actually depends on a whole bunch of things working together. You've got your cardiovascular system, how much blood your heart can pump. Then you've got your muscular system, how much muscle mass you have and what type of muscle fibers. And of course, your pulmonary system, basically how good your lungs are. It's this complex dance between all three that determines your final score. Okay, that's enough theory for now. Let's actually head into the lab. What kind of gear and prep work do you need to pull one of these tests off? Yeah, this is definitely not something you can do with your smartwatch. We're talking serious specialized lab equipment. You've got the treadmill, of course, a heart rate monitor, but the real star of the show is that gas exchange system, the COSMED K4B2. That, along with the face mask, analyzes the exact makeup of every single breath you take in and exhale. And listen, before anyone even thinks about stepping on that treadmill, there's a crucial step: calibration. Accuracy is everything. The whole system has to be perfectly tuned with both regular room air and a special reference gas. If you skip this, the data you get is basically worthless. Scientific precision is the name of the game. And it's not just the equipment. The environment itself has to be super controlled. I mean, think about all the things that can throw off the results. How you slept, your emotional state, whether you had coffee that morning, what your last meal was, even the temperature and humidity in the room. To get a true, valid reading, you've got to control for all of this stuff. All right, the lab is prepped. The athlete is ready. It's time for the main event, pushing to exhaustion. This is where we get a step-by-step look at the protocol, where mind and body get pushed right to the edge. The protocol itself is actually pretty straightforward. First, a good 10-minute warm-up. Then you get all the gear on: the heart rate monitor, the K4 unit, and that face mask, making sure it's nice and snug. Then you hop on the treadmill. It starts at a pretty quick 13 kilometers an hour with a little incline. And then every 2 minutes, bam, the speed goes up by another click. And you just keep going until you literally cannot go anymore. It is all about voluntary exhaustion. And this is what it looks like in action. You've got the athlete totally focused, pushing through on the treadmill. The technician is right there, watching the data pour in real time. It's this controlled, incremental push, all designed to find an athlete's maximum oxygen uptake as safely as possible. There's this great little line from the protocol that I just love. It says, this subject will be verbally encouraged for his excellent performance to prolong his running if possible. Even in this super scientific clinical setting, there's that human touch, right? Someone yelling, "Come on, you got this." Because sometimes that's exactly what you need to find out where your real limit is. Okay, the test is over. The athlete is completely gassed, trying to recover. But in a way, the most important part is just getting started. It's time to decode the data and figure out what all those numbers and graphs actually mean. Okay, this is where it all comes together visually. Take a look at this graph. You can see how as the intensity ramps up, the oxygen intake, that's VO2, and the heart rate, HR, they just climb and climb together. But then look what happens right at the very end. They start to flatten out. They plateau. That is the moment we've been looking for. That's the VO2 max. It's the point where no matter how much harder you push, your body physically cannot take in and use any more oxygen.
And all that data from the graph gets boiled down into a few key numbers. You get your absolute and relative VO2 max scores, of course. You find out your true max heart rate, and you get this other super useful metric, VO2 max. That's the actual running speed you were at when you hit your max, and that's a game changer for designing your training.
So yeah, the test itself ends the second the subject signals they're done, usually by grabbing onto the rails for dear life. But the measurement isn't over. A 10-minute passive recovery period kicks in immediately. They're still collecting data, watching to see how fast your body can recover and get back to normal, which is, believe it or not, another huge indicator of your overall fitness.
All right, so let's boil this all down. What are the key takeaways? First, VO2 max really is the best test out there for predicting endurance success. Second, it's all about measuring your body's maximum oxygen consumption when you're going flat out. Third, the test itself is a controlled, step-by-step process designed to push you to your voluntary limit. And finally, the results are pure gold for identifying what you need to work on and measuring your improvement over time. And that right there is really the whole point, isn't it? Knowing your limit is one thing, but this test isn't just about finding a wall. It's about drawing a line in the sand. It gives you the information, the blueprint you need to train smarter. So the real question it leaves you with is, how do you plan to push past it?